Hi, my name is Dr. Manuel Correia. I'm the medical director and co-owner of Blurr'd Lines Medspa in Dartmouth, Massachusetts. Today I want to explain a little bit about Morpheus8 and the procedure and what does it entail. And the best way to do so is through a live demonstration with one of our very own patients here at Blurr'd Lines.
I wasn't sure what I needed to do because I had suffered with this acne scarring really my whole adolescent, young adult. And then once the scars are there, they're there, and creams don't seem to do the fix for that. So I did my research on the Morpheus8, and that was what I wanted to do to really go deep and smooth out these lines, these scars that I had from the acne. And so when I found out that at Blurr'd Lines, that's the technology that they had, that was where I wanted to be. I really wanted to use the highest technology. Well, I did read that it is uncomfortable. It was yielding the best effects.
Hi, my name is Dr. Manuel Correia. I'm the medical director and co-owner of Blurr'd Lines located in Dartmouth, Massachusetts. Morpheus8 is a microneedling system that utilizes radio frequency energy. The combination of both microneedling and radio frequency is a powerful way to rejuvenate skin by eliminating old and aged layers located directly underneath the skin called the dermis, as well as superficial layers referred to as the epidermis. The elimination of older layers of skin prompt the body to develop newly formed layers. This is done by fibroblasts, which stimulates new elastin and collagen production, which is what gives skin its flexible and smooth appearance. This process is what tightens pores, reduces wrinkles, and gives skin that youthful look. The way Morpheus8 delivers these results is by using small microneedles to penetrate the skin at different levels and deliver radio frequency energy down those needles into the skin. All right, so we're going to be using a primed pin, which is a smaller 12 needle pin. This allows us to get into smaller areas, specifically around the mouth, which is her biggest concern right now, underneath the eyes. Again, it's a smaller block pin in comparison to the larger one that we used for the neck. The radio frequency essentially denatures and destroys the surrounding tissue, therefore causing small areas of damage that the body then repairs. The device has the capacity to go down to 4 millimeters, which is the deepest FDA-approved level for the face. The device can be set to different levels, namely 4 millimeters, 3 millimeters, 2 millimeters, 1 millimeter, and can even be as superficial as a ½ millimeter through a device that we call a resurfacer. That is the microbiological explanation of how Morpheus8 works. It takes some amount of talent and expertise to implement this device in an effective way. First off, pain management is key. Without proper management, it is difficult to complete the procedure at effective energy levels in order to get the best results. Therefore, at Blurr'd Lines, we have an array of techniques used to provide sufficient pain management. The first level of pain management is applying a transdermal lidocaine tetracaine mixture to the skin about 45 minutes before the procedure is started. Then, we can use tumescence, which is a combination of lidocaine and saline, which we inject into larger areas of the skin, such as the neck, the abdomen, the buttocks, thighs, chest, back, and arms. For areas of the body, especially the face, there are very effective nerve blocks that can be performed in order to knock out regional areas of nerves to produce excellent anesthesia. There are 3 major nerve blocks of the face that can help control pain. The first is the infraorbital nerve block, which is located just below the eye in the midface. This nerve bundle provides sensation to much of the midface, the cheeks, and the upper lip. It is accessed through the mouth, up along the gum line, as you would typically have performed in a dental office. The second is a mental nerve block, which are nerve fibers located in the lower jaw. This collection of nerve fibers provides sensation to the lower jaw and lower lip. It is accessed again through the mouth and the lower gum line. So we're going to be doing an infraorbital nerve block, which is this nerve that is in the face area, we access that through the mouth, and we're going to numb that area up, and this is just strict lidocaine. Again, you need to measure out how much lidocaine you're going to use. There's only so much that you can use. Typically, it's 3.5 to 4 milligrams per kilogram. That usually translates into about 300 milligrams worth of lidocaine. So for her, we've calculated everything out. That includes the transdermal, and we're going to work on providing a nerve block. Do you want some Pronox?
Do you want to use some Pronox before he does the injection, or you want to go for it?
All right.
All right.
So open up. Okay, we're going to do just like last time. Okay. Okay. Do you need something that you want to spit out, that stuff, the Lido? You okay? Okay. So we're just going to that's going to kick in while we do down here, okay? The third facial nerve block is called the supraorbital nerve block, which is located just above the eye at an area called the supraorbital rim. These nerves supply sensation to the forehead and to the scalp. Here you'll find two major nerve groups, one referred to as the supraorbital nerve, the other as the intratrochlear nerve. They are blocked by injecting lidocaine in what is called a field block, wherein a small line of lidocaine is injected across an area that the two nerve fibers are located. These two nerve fibers are relatively close to each other and can be blocked simultaneously. The amount of lidocaine used is limited to 4 milligrams per kilogram in order to avoid lidocaine toxicity. For example, in a 155-pound person, their approximate weight is 70 kilograms, which translates into 280 milligrams of lidocaine for a maximal dose for that patient. This must be calculated to ensure safe dosing prior to the procedure. And finally, the biggest asset that we offer for pain management is called Pronox. Pronox is an effective sedative that is a 50-50 mixture of nitrous oxide and oxygen. This composite of gas is commonly referred to as laughing gas, as it eases anxiety and helps alleviate pain. That allows us to really proceed with the procedure.
How do you feel? Need some more?
How you doing there, Joe?
I'm good.
Are you feeling it? Is it hitting? All right. Okay. So now we are going to start the procedure. We include these modalities of pain management in the pricing of all of our Morpheus treatments. Now that we have discussed how Morpheus8 works and how we manage pain, let's move on to the procedure itself. Once the numbing is complete, we then work on the desired portion of the body, which can include the face, neck, chest, arms, abdomen, love handles, back, buttocks, thighs, and knees. The most commonly requested treatment is for the face and neck. We set our energy levels depending on the depth of treatment area. We can use higher energy levels for deeper levels. As we get more superficial, we use lower energy levels. The more superficial levels tend to be more sensitive, as pain fibers are located very superficially in the skin. This is why pain management is extremely useful in being able to obtain best results. The procedure time itself depends on the body part being worked on. The procedure can be completed in most cases from beginning to end in under 2 hours. The real secret to best results lie in the appropriate energy levels and depths of treatment. The depth depends on the area that you're working on. For example, the cheeks have a fair amount of fat, so deeper levels can be attained in this area with higher energy levels. The forehead is mostly skin and thin muscle, so therefore is more superficial, and we typically only require going as deep as 2 millimeters with lower energy levels. The number of stamps or triggers of the device will help appropriately cover the area of treatment. Typically, the more stamps, the better the outcome. Again, management is important in obtaining proper number of stamps during the treatment. All right. Right, Jeff, so let me know here, okay?
Right.
We're going to do some tests for
start?
you. Yep, we're going to start and do some test ones for you. How'd you do?
Perfect.
How you doing?
Perfect.
Yeah?
Yep.
Don't lie to me.
I'm not. Can't feel a thing.
You're awesome.
Little tiny.
We're going to go to town now.
Yep. Can't feel anything on that side.
Well, you're going to feel probably underneath
Little
here.
kick.
Love this small pin. Just gets right into that area and just hits that spot perfect. A special add-on for Morpheus is platelet-rich plasma. PRP is useful in healing and, again, stimulating elastin and collagen development, which is the cornerstone of skin rejuvenation. The procedure itself includes taking 23 cc's of blood from your arm. We then place that blood into a special centrifuge vial. That vial is then spun in a centrifuge machine. We separate red blood cells from the serum portion of the blood. We then take the serum portion and spread it on the area that the Morpheus has been performed on. We turn down the energy, but we may not necessarily get the right results. So what we want to do is provide as much pain management as we can. Everybody's different. Different people can tolerate pain differently. Jo is a warrior. She did great. This is her third treatment right now, and I'm very hopeful that we're going to get some amazing results after this last one.
Definitely.
Right now what Joe's going to do, we're going to do PRP. So PRP is platelet-rich plasma. Jonathan's going to take some of her blood, and we're going to spin it through the PRP machine that's located there. And we're going to, now that we've done the microneedling portion of it, we're going to apply some PRP to infuse into the area that we've just microneedled. It helps to soften the skin. It helps in healing of the tissue, especially after the procedure. My patients love it. They love the effect of it. Joe's had it.
I had it the first time.
What did you think?
Loved it.
Yeah.
Loved it.
Yeah. So
Especially to be able to sleep with it on.
Yeah.
I feel like
Leave it
set
on
in
overnight. Let it set in, and beautiful.
I hated to wash it off, but I had to. It didn't work.
So
I loved it.
as far as the PRP that we offer it with all of our Morpheus treatments for anybody that's interested. Again, I think it does help promote the skin. It really does give a wonderful feel to the skin. It softens it. Just helps all around on many different levels. Again, what we're looking for is the platelet-rich portion of her blood. And Jonathan is actually going to be performing this procedure. The serum is taken from the vial and spread onto the area that the Morpheus was used to treat. Tens of thousands of holes are created by the Morpheus treatment, allowing for the platelet-rich plasma to seep into the skin layers. It remains on the skin until the following morning. Many patients experience an incredibly smooth skin sensation from this procedure. As far as getting best results, multiple sessions of Morpheus are required. Typically 3 sessions are ideal. The treatments are separated by a month so that an entire treatment process will take approximately 60 days. The patient may experience notable results within even the first month. However, the process of elastin and collagen stimulation formation peak at about 6 months. Therefore, even after your last Morpheus treatment, you will see further improvements over the course of the next 4 months. Hence, at 6 months, you will see peak results from the Morpheus8 treatments. Because the aging process is continuous, Morpheus8 results do require maintenance on a yearly basis, once yearly typically. Without maintenance, Morpheus will last 2 to 3 years. With maintenance, you can expect results lasting anywhere from 6 to 7 years, and this will require a full set of 3 treatments, again, in order to get that level back to where it was. We offer and accept special financing via Care Credit, which is available for all of our Morpheus packages. That's a brief summary of Morpheus8 and what you can expect when you choose to have your treatments done at Blurr'd Lines of Dartmouth. Again, my name is Dr. Manuel Correia, and I hope to see you soon.